Okay. Well, good afternoon, everybody. My name is Aaron Ford, and I'm your Attorney General. I want to begin by thanking Andy Bishop to my right. Did I say it right, Bishop?
Bishop.
I was going to say Bishop. Andy Bishop, the President and CEO of Boys and Girls Club of Southern Nevada, and Jessica Rowe to my left, the Vice President of Programs for Raise the Future, for being here with me today to discuss updates on the opioid settlement funding flow into our state and the many important benefits this money brings to Nevada. I also want to introduce my right-hand man in this particular endeavor, my Bureau of Consumer Protection Chief, Mark Kruger, to my far right. He's also here to entertain questions you may have at the very end. Since I've taken office, I've talked about the mitigation of the opioid epidemic as being one of the most important things we do. It was going to be at the forefront of my work as Attorney General. The sheer scale and impact of this epidemic, especially in Nevada, meant that we had to strike full force to hold bad actors who facilitated these impacts accountable. And that's just what we've done. In June of 2019, a few short months after I became your Attorney General, I announced that my office had filed an expanded complaint against multiple opioid defendants to again hold them accountable for the harms, risks, and impacts that the opioid crisis that it had on the opioid crisis here in Nevada and its residents. 3 years later, in March of 2022, I announced that we had settled with nearly all of the defendants in our state's opioid litigation. At that time, the amount of money that we had brought in to mitigate Nevada's opioid epidemic was over $1.1 billion. Last week, I announced that we increased that number by signing on to a $7.4 billion settlement with Purdue Pharma and its owners, the Sackler family. Nevada's state and local governments will be receiving approximately $58 million from this settlement over the next 10 years, which brings the total that our state has received through these settlements to $1.2 billion. Out of that number, $462.2 million will go to the state's Fund for a Resilient Nevada for abatement, and $370 million will go to other signatories of the One Nevada agreement that I will address in short order, also for abatement. The Fund for Resilient Nevada uses the money to support some fantastic programs and projects that are designed to mitigate the opioid crisis all across our state. You will hear from some dedicated workers who've made use of this funding in just a moment, but I'd like to mention a few programs that have been awarded funding through the Fund for Resilient Nevada that are not here today. The Frontier Community Coalition has received $233,000 to address critical mental health care needs for children in Nevada's rural communities, including intervention and prevention strategies for opioid misuse. Over $3.8 million was used to purchase mobile recovery units for 3 qualified servicers in Nevada. These units will help our recovery efforts reach throughout rural Nevada, where services are more limited than in our urban areas. $750,000 has been awarded to the Nevada System of Higher Education to analyze samples from sites like wastewater treatment and sewer collection facilities to gather data on drug use on a community-wide scale. So as you can see, this money is going to do real things and to help real people. Every dollar that comes into Nevada means more help for Nevadans. In addition, the Fund for a Resilient Nevada works with local governments to identify real needs for opioid abatement going on right then and there, and shares in those programs and services that address these real needs. These needs are different in different parts of the state, and they change, so it's important for the state and local governments to work together. These monies are important because it arms our state and local county and city governments with money that we need to address unique challenges in our communities. I firmly believe that Nevadans are stronger together, and I know that the communities that are receiving these funds and feel these impacts also believe that as well. As such, when we began our work on opioids, members of my office met with each of the counties and litigating cities in the state to work out an agreement, the One Nevada agreement, that would give our state and its communities the best options for bringing home funds that were desperately needed to fight this epidemic. The agreement that was created, again, the One Nevada agreement on allocation on opioid recoveries, was a product of discussions between state and local leadership that set aside differences, politics, and agendas to come together for our state as a whole. The signatories of the One Nevada Agreement received their money for use in their own abatement programs and efforts, and to tackle the needs of their communities and geographic areas as they see fit. Or, as I said, they work together with each and every one in this state in order to fund programs and services. We brought this money home to Nevada for those who struggled with addiction, for those who have lost loved ones, and for those who helped friends or family members fight this terrible disease. When Nevadans suffer, we don't sit down and do nothing. We actually hold accountable those who caused this suffering. We find ways to end the suffering, and we help those members of our Nevada family who need help. We look after our own here in Nevada. And with that, I'm proud to turn it over initially to Andy to discuss a bit about how this money has helped him do just that, and then we will hear from Jessica to hear how this money has assisted her as well. Andy.
Thank you. Again, Andy Bischel, CEO, Boys and Girls Club Southern Nevada, but I'm representing the state alliance of 5 Boys and Girls Club organizations throughout the state, representing 34 communities in the state. Boys and Girls Club is committed to expanding relevant and responsive wellness programs throughout Nevada, focusing on tweens and teens ages 10 to 15 years old. Clubs deliver health programs empowering youth to build skills to address real-world problems in a safe space outside of schools, and in a manner that is youth-led, adult-facilitated, and project-based and creative. In February of 2024, Boys and Girls Club entered into a multi-year partnership with the Fund for Resilient Nevada to deploy statewide opioid abatement and prevention program. The Boys and Girls Club Opioid Prevention Initiative, Smart Moves, has 3 objectives. 1, increase knowledge, coping, and resiliency skills for 2,900 youth ages 10 to 15 years old in 34 communities each year. Number 2, prepare program staff as responders to opioid interventions and referrals. And 3, reach families with important opioid intervention and prevention resources. In the project, we are meeting and exceeding these objectives. Notably, 91% of the youth reported greater recognition of opioid risks and feel more confident in addressing substance misuse concerns with friends and family. Boys and Girls Club has over 270 staff trained in early intervention of opioid overdose and has 27 youth centers stocked with life-saving Narcan. Additionally, over 700 families have connected with clubs in their communities to learn more about keeping their kids safe from opioid exposure. We applaud the Attorney General and Fund for Resilient Nevada for their partnership to empower tweens and teens in critical information and skills. We look forward to expanding our efforts to serve more youth in the coming years and adding innovative strategies to address mental health wellness and interventions. Thank you.
Good afternoon. Thanks for being here. I've been working in the child welfare space in Nevada for 15 years. My name is Jessica Rowe, and I'm the Vice President of Programs for Raise the Future in Nevada. I want to share a little bit about what we believe at Raise the Future. We believe that every young person deserves a permanent, loving family and support that they need to thrive in that house. We're here today to talk about the real and lasting impact of opioid settlement dollars and to shine a light on a group too often overlooked in this epidemic, the children. While public attention rightfully focuses on treatment and recovery for adults, we cannot afford to ignore the children left behind in the wake of addiction, who, without intervention, would become a new generation of addicts. And thanks to public-private partnerships between Raise the Future and Dave Thomas Foundation for Adoption's Wendy's Wonderful Kids program, and funding in part by grants from the Fund for Resilient Nevada, we're able to do something powerful. We're not just treating trauma, we're helping rewrite futures. Raise the Future implements Wendy's Wonderful Kids because we are both dedicated to finding permanent families for the longest waiting children in foster care in our state and across the nation. Children impacted by parental opioid misuse frequently enter foster care not because no one loves them, but because the adults in their lives are trapped in addiction, instability, and trauma. And in the process, these children lose the safety, consistency, and connection they desperately need. In fact, many of the children served by Wendy's Wonderful Kids have experienced multiple placements, deep trauma, and long waits in care, some for years. Others are placed with relatives or older siblings trying to hold the family together without resources or support. But these kids don't need pity. They need people and plans that don't give up on them. Here's where opioid settlement dollars come in, and where programs like Wendy's Wonderful Kids change the game. Opioid settlement dollars allow Raise the Future to implement recovery communities for kids that connect them to loving homes by using a child-focused recruitment model, which means that every child gets a dedicated, specially trained adoption professional whose job it is to build relationships, dig deep into case files to find that one caring adult for every child, and find that permanent family, especially for older youth, children with special needs, and siblings. These are the kids most at risk of aging out of foster care, kids who often have been told, either directly or indirectly, that they're too much, or that permanency isn't in the cards for them. But we believe otherwise, and we have thousands of proof points that show what happens when we invest deeply in one child at a time. We are currently looking for families for 274 youth throughout the state of Nevada, but right now I just want to tell you the story of one. I have changed her name. Her name's Lena, a teen who entered foster care after her father died from an overdose, and her mother's addiction made it unsafe for her to stay. By the time Lena was 14, she had lived in 7 different homes. She had stopped attending school regularly. She was quiet, withdrawn, and didn't trust that anyone really wanted her. Then she was referred to a Wendy's Wonderful Kids recruiter at Raise the Future. And that recruiter didn't just manage her case, but she showed up, met with Lena consistently and often, and really got to know her. She helped Lena feel seen and safe enough to open up about her dreams and fears. Then she started doing the hard work, combing through old case files, calling former foster parents, reaching out to extended relatives. Eventually, the recruiter connected with Lena with an aunt, someone who had lost touch with the family years earlier, but who still wanted to be part of Lena's life. With support, training, and resources funded by opioid settlement funds, Lena's aunt became her permanent legal guardian. And now Lena has a bed with her name on it, a school where she's thriving, a family that answers the phone every time she calls. This kind of outcome is not an accident. It's the result of smart, targeted investments in proven programs like Wendy's Wonderful Kids. Opioid settlement dollars through the Fund for Resilient Nevada have helped expand access to specialized recruiters trained in trauma-informed practices and permanency planning, support staff to child ratios that allow deep, persistent work with each child, not just quick case updates, fund family finding efforts, including travel, file reviews, and engagement of relatives who may not even know that the child is in care. And the research backs it up. A national 5-year evaluation conducted by Child Trends found that children referred to the Dave Thomas Foundation for Adoption's Wendy's Wonderful Kids program are up to 3 times more likely to be adopted and far more likely to be placed with people they already know, relatives, former teachers, or even former foster parents. And here's the bigger picture. When we provide stability and permanency to children affected by the opioid epidemic, we're not just healing their trauma, we're stopping the cycle. Children of drug-addicted parents are 8 times more likely to become addicted themselves, according to the National Institutes on Health. Children who age out of foster care without permanent connections are more likely to experience homelessness, unemployment, early unplanned pregnancy, and yes, substance abuse. But when we invest in permanency early, when we say to a child, you matter, you belong, we won't give up on you, everything changes. The dollars that support models like Wendy's Wonderful Kids are not charity. They are smart, evidence-based investments in children, families, and long-term recovery. We urge policymakers, journalists, and the community to ask, are we treating the opioid crisis as a family issue, not just a medical one? Are we funding programs that find permanent, loving homes for the kids left behind? And are we putting dollars behind what we know works instead of just what's been done before? We cannot change the past for these children, but we can fight for their future. And the message is simple. No child should have to suffer twice, once from a parent's addiction, and again from a system that gives up on them. Let's continue to build systems that say to these young people, you are not invisible, you are not forgotten, and your future is worth investing in. Thank you.
Very, very touching stories, and I got goosebumps just hearing it. Andy and Jessica, thank you so much for your work. I really got goosebumps right now. You guys are doing yeoman's work on this, and I want to thank you for your dedication to this area. It's a tough one to work in, and as much as I'm proud of the successes, I remain heartbroken by those that we lose. Just this morning, I was talking to one of our colleagues, Mark, as I walked around the way, an individual that we were just recently interacting with at the office. We've learned has passed away from a fentanyl overdose. This is a problem that continues to permeate the entirety of our state, and it touches more people than you may recognize. And so I'm proud of the work that Mark Kruger and his team have done. I'm proud of the effort that this office as a whole has undertaken to address this. We're not done. Anyone who has contributed to this epidemic of the opioid crisis in our state will be held accountable under my administration. We are proud of the $1.2 billion that will be bringing in over the next 20 years to address this issue, and wanted to just share that information with the public. Again, thank those service providers, and also thank the Fund for Resilient Nevada with the Department of Health and Human Services that works so diligently to ensure that these funds are spent to abate the opioid crisis. And so with that, I will tender the mic and offer an answer to any questions you may have.
A couple of questions. One, have both of you already received the funds, and if so, when was that?
Correct. We've had funds for, boy, I'm trying to think of when they hit, but it was early this year.
Sure.
Yeah, same.
Okay.
Just over a year.
Awesome. And then AG4, you mentioned, this not being done and that you're continuing to fight. And Jessica had mentioned seeing this through like a family issue. What are some other things that like both policymakers and just people should be looking at as far as, what other issues could be solved, looking at it through this family lens?
Well, I really appreciated her mentioning the family, because anyone who works with me knows that I talk about we represent the entirety of the Nevada family. And when we look at it from that back of what's happening to others, it's happening to us. And so policymakers have the ability to keep that in mind, and should keep that in mind as they draft policies to address issues. She talked about foster care. Many may not recognize the impact of the opioid crisis on children, and children specifically in foster care. But we did in our office, and we've been working with policymakers to ensure that we have a very wide approach, a very, very fulsome approach to addressing this issue, and not looking at it from small siloed arenas. And so I would suggest that we all continue thinking about this from the Nevada family perspective. I'll say this as well, to her credit, Marilyn Kirkpatrick on the Clark County Commission has been working with this office for years to help address this as well. The Clark County, I believe, is utilizing $45 million of opioid funds to open up a resiliency center of their own. And again, thinking about ways in which we're able to assist the entire community is the way that I would suggest that we continue their approaching this. Any other questions?
Yeah, just over the course of time as the programs work their way and are tracked, what would be the number you hope to see the amount of reduction of opioid use reduced to?
Well, that's a great question, and I will say, obviously, utopia for me is that we eradicate it. But I will frankly have to leave it to the professionals to talk about what we can, in reality, anticipate. What we're looking to do is to stop as much harm as possible. And again, as much as I praise these two who are around me right now, just this morning we had a conversation about someone else we lost to fentanyl. That's not a conversation that I want to have. And until we have done the very level best that we can to eradicate this problem, I won't feel that the problem has been addressed.
But it's fair to say, he mentioned the number 91% that they saw, and then were able to intervene in those cases to where they are in the right path. So that's
Sure.
very promising
Yeah.
data.
Yeah, the 91% is that our kids feel comfortable talking to an adult about the opioid problem and addiction and what that means because they are seeing it in their communities, right? So it's not only dealing with what we're facing today, but it's preventing what happens in the future, and that is really where we're trying to step in and work with kids as young as 10 years old to make sure that they're aware that these things are out there and how they can impact your life, and or what are they seeing at home, right? So how do we help these kids really make an informed decision on what their future holds?
I want to jump right back to a question you asked about policymakers. I want to reflect back on a session ago, not this most recent legislative session, but a session ago where my office sponsored a bill to increase the penalties for trafficking in fentanyl. That was an important conversation to be had, and as policymakers, it was an important one from several different perspectives, not just a criminal justice perspective, which is the perspective that I was bringing at that juncture, looking at trafficking, not at mere usage, but trafficking in fentanyl. The conversation was important because we had stakeholders who reminded us that this isn't just a criminal justice issue. It is a public health issue. It is an issue that we need to be looking at harm reduction techniques and strategies as well. It's a dynamic issue that requires a dynamic solution. I've been known to say that we may live in a silver state, but there's no silver bullet when it comes to many of the problems that we face, and opioids is no different.
I know that we just finished the legislative session, so maybe it's not on the radar yet, but is there any policy proposal that you're thinking of for next session when it comes to addressing those other family aspects and not just criminal justice and not just public health?
I can't speak to any specific ideas that I have at this juncture, but rest assured that we will continue having conversations and working with interest groups around these issues, because again, until the problem is eradicated, I feel that the work is left undone.
Is there anything else to share today, just with the other drug companies, or the Purdue is where it leaves off right now over the course of, you said the next 10 years, they'll be paying yearly?
Yeah. Why don't I ask Mark to jump in, and he can name a lot of the companies with whom we've had settlements. Some come to mind for me, but Mark probably has a better memory. Mark, you want to share?
Sure, thank you. We have done settlements with several other companies, both manufacturers, distributors, and pharmacies. So some of the pharmacies, for example, are CVS and Walgreens. Some of the manufacturers, Endo, Mallinckrodt, and now Purdue. Then in addition to that, we did the distributors, those settlements. We're still working with some other manufacturers and hope to, in the near future, have some additional settlements announced in that regard. And then we also have still active litigation against pharmacy benefits managers.
And just a technical question on that, the monies received, is that up to your office to have discretion to how to fund that, or does it have to go back to the legislature and they have to say what the numbers are? Is it?
General Ford has the ability to manage the litigation and make decisions on settlement. However, any recoveries are already statutorily obligated to go to mitigation efforts and abatement.
And we make no decisions, my office makes no decisions on how those monies are spent. We've mentioned the Fund for a Resilient Nevada at least a half a dozen times. That's where the money goes. It goes to the Department of Health and Human Services, and they make determinations on how that money is to be spent. Thanks, everyone. Thanks for coming out.